You're watching Reality Check. India's vaccine drive, so crucial to contain the current surging virus. That's how crucial the vaccine drive is, and it's also to insulate against a future wave, but the vaccine drive is faltering. Much of the blame is being placed on the centre's confusing, fragmented policy, where the centre buys and pays for only 15% of vaccine stock for those above the age of 45, leaving states and private players to compete for the rest to vaccinate those from 18 to 44. This, coupled with the centre's baffling delays in placing orders for vaccines, has meant state after state has run out of vaccines, especially for the 18 to 44 category. Here's a quick roundup of where we stand of just some key states. Delhi, vaccination for 18 to 44 at government centres has been suspended. Maharashtra, same story, 18 to 44 vaccination, government centre suspended. Same in Bihar, where vaccination for this age group has been suspended in centres in Patna and also some other districts. This is according to the New Indian Express. In Karnataka, the vaccination for the 18 to 44 age group is possible, but with restrictions. In Tamil Nadu, there is limited vaccination for this particular age group. Same in Odisha as well, limited vaccination for 18 to 44 age group. Only 4 districts reportedly have government centres which are administering vaccines in this category. Himachal Pradesh may have to suspend vaccination for this age group, since according to reports only about 4,000 doses are left as of the 1st of June. This is according to the Hindustan Times. Now, Chief Minister after Chief Minister are speaking up. Even supposedly neutral Chief Ministers like Naveen Patnaik of Odisha have weighed in, writing to the centre asking them to reverse their decision. And the Supreme Court today had strong words calling the centre's policy of paid vaccination for this 18 to 44 year group as prima facie arbitrary and irrational. And yet, just a few days ago, union ministers were claiming that there was no problem and that all Indians will be vaccinated by the end of the year.
दिसंबर तक 216 करोड़ डोसेस यानी 108 करोड़ लोगों का वैक्सीनेशन कैसे होगा, इसका पूरा खाका दिया है। कोविशील्ड, कोवैक्सीन, झाइडस कैडिला, नोवावैक्स, जेनोवा, स्पुतनिक देश में तैयार होने वाले और बाहर से भी जो स्पुतनिक आया है, इन सबका उल्लेख उसमें है और कितने आएंगे ये भी लिखा है। उसकी टोटल 216 करोड़ होती है राहुल जी। तो ये समझ लेना कि भारत का वैक्सीनेशन 2021 में ही दिसंबर के पहले पूरा होगा।
So first of all, the Chief Minister there was saying plan to vaccinate 108 crore Indians. So is it all Indians or only 108 crores? Because he said 108 crore Indians will be vaccinated by December. Now, India's population, according to the 2011 census, is 121 crore. So why the figure of 108? That's not very clear. But even if we assume that figure, let's look at the gap between our production capacity and what we actually require. The daily production capacity is roughly 28 lakh doses a day. We require to meet this target that the minister just announced 91 lakh doses a day. So the production has to be ramped up over 3 times in order to meet that target. At the current capacity, it will take over 2 years to vaccinate 108 crore people. Is such a massive scaling up realistic? Vaccine makers, by the government's own account, are barely able to keep up current targets. The centre, in a statement released recently, said that the Bharat Biotech was able to only meet 44% of its March-April target. Of 2 crore co-vaccine doses ordered in March, only 88 lakhs were delivered for that month. Also, the push to ramp up the vaccine production, is it too little too late? The government has been talking up how 3 more firms got the nod to produce Covaxin, but that was only this month, May. These additional firms, by the way, will only end up producing about 18 lakh additional Covaxin doses a day, which isn't really that much. Who are these firms? The Hafkin Corporation, 6 lakh doses a day. Bharat Immunologicals and Biologicals, 5 lakh doses a day. A Gujarat COVID Vaccine Consortium, 6.7 lakh doses a day. And another firm, Indian Immunologicals Limited, no information on that. Joining us on Reality Check, K. Srinath Reddy, President, Public Health Foundation, Dr. Shashank Joshi, Member, COVID-19 Task Force, Maharashtra, Dr. Vishal Rao, Expert Committee Member, COVID Task Force, Government of Karnataka, Debashish Roy Chaudhary, former journalist, author of To Kill a Democracy, India's Passage to Despotism, which is expected soon, and Priyanka Pulla, freelance journalist, been reporting on vaccines and on this pandemic. Let me just start with you, Dr. Joshi, because last time we spoke, you were talking about how dire the vaccine situation was in Mumbai/Maharashtra. When you hear these very glowing projections from the center of huge amounts that are to come, what's the ground reality? Are you still struggling?
So we are clearly still struggling. There is no question asked about that. Though I must admit and confess that in the last week and the last 2 weeks, there has been some marginal ramp up, particularly above 45. So that part has got ramped up. We are trying to ensure that all the frontline workers and healthcare professionals who are not vaccinated, they are vaccinated. But clearly between 18 to 45, virtually there is a virtual standstill.
So 18 to 45 are the standstill. The centers, are there any centers still, government centers, able to do it? No.
Very, very few. So as I said, there is a huge supply challenge. Okay. And I hope and pray that what they have committed, they are able to fulfill in the months of June, July and August. Even now we are in the first week of June and we are not seeing any large supplies which are coming in.
Okay.
So we are definitely nervous and tense. Let me be very upfront about it, because vaccination is one of the only ways we can mitigate further ways. We need to saturate our population. It's a high target place. You know, Mumbai, Pune, some of the districts are very vulnerable districts.
No, of course. Maharashtra is very sensitive and important. What's the story or what's the situation in Karnataka, Dr. Rao? Are you again struggling, especially in the 18 to 44 category?
Srini, the demand seems to be much higher than the supply, obviously, at this juncture. And I think even the private sector is also grappling to a great extent to procure vaccines, because they need to directly reach out to the manufacturers and get it at this juncture. So we definitely see that there is a lag between the demand and the supply.
Right.
And that's creating a lot of anxieties. And I think another concern is also vaccinating people where there is testing going on. Now that increases the pressure on the existing system. So I think we need to look at strategies that will diffuse this, because in the coming days, this is going to go on further, increasing the gap.
This could be a problem. Dr. Reddy, given the ground reality, these highly exaggerated or over-optimistic estimates that we will be able to produce close to the range of 1 crore a day when we are barely able to manage 20-24 lakhs a day seems unrealistic and also worrying, because if we are not able to ramp up, then there's all this fear of another wave.
Well, clearly we must accelerate our vaccination rate and increase the coverage as extensively across the country as possible. Let me give you the reasons why. If you look at Brazil, which has also been in the throes of a major epidemic there, worse than even ours, in the province of Serrana, where about 60% of the people received vaccination between February and April.
Yes.
There was a 95% reduction in deaths and 86% reduction in infections.
Yes.
Contrast this again with another province in Brazil, Manaus, where even with 76% antibodies from natural infection, the serosurveillance studies in January, the epidemic was still raging. So clearly you require potent vaccines in order to protect the population. And in fact, what was used in Brazil is Coronavac or Sinovac, which is an inactivated virus vaccine, which is very much like our Covaxin. But I think the biggest validation also comes in from Britain, where yesterday was the first day since March 2020 when they have recorded 0 deaths from COVID. Again, with an accelerated vaccination program. So we do need to protect as many of our people as possible, as fast as possible.
That's really important, but there's this constant, Priyanka Pulla, mystery over production figures, because none of the vaccine makers are supplying proper production figures. The court has now, Supreme Court has asked the government to supply this data, and there's particular opacity around Covaxin, about which you wrote a terrific piece, a long piece in the Mint. Times of India was pointing out how, according to their estimates, about 2 crore doses of Covaxin had been administered till the end of May, May 27th, but about 6 crore doses should have been available, according to the projections of the government's own figures and estimates. So 4 crore doses have gone missing, but Bharat Biotech's clarification has been a little strange. They say there's a 4-month lag from production to vaccination, it's a complex process and so on. So there are all these questions just about, how much vaccine is actually getting produced. Priyanka.
Yeah. So I don't think while my story was about Covaxin, I don't think the opacity problem is restricted to Covaxin alone. I'm not sure what is an echo. So my story was basically about clinical trials and the pace at which these companies are releasing data. It applies to Serum Institute of India, which still hasn't published its bridging study 5 months since the product was launched, which is quite incredible because the bridging study was a crucial bit of data based on which the vaccine was approved. Right. Now, coming to the supply issues, you're right. But I don't see how we could not have anticipated it because if you go back to Bharat Biotech's statements last year, at no point of time did they say that they were going to be able to make more than 150 or 200 million doses annually. And now we are talking about reaching 1 billion doses, right? And they never even hit the 200 million annual capacity so far. They're far below that capacity in terms of what they've supplied. And in many ways, it's understandable because inactivated vaccines are really hard to make. Right. And they've been hit by major supply issues because of the Defense Production Act. They've faced major raw material shortages. In general, just growing those large cell cultures and growing huge amounts of live virus and then inactivating it, it's a difficult process compared to the other vaccine platforms. Right. So, yeah. So
you're right to say that we should have seen this coming, but we clearly didn't. And in fact, Debashish, you wrote a piece for Time magazine where you pointed out that this kind of somewhat delayed and sort of botched up response of India in terms of being able to place sufficient orders is not just derailing our own vaccine drive, but is impacting the global vaccine drive.
Yeah. I guess that's what Dr. Soumya Swaminathan, the chief scientist of World Health Organization, told you as well, right? That this is eventually going to affect the whole world. And this potentially makes the pandemic much longer. Yeah. Because new strains will appear, and all these countries, there are about 12 countries which haven't had a single dose yet, and there are many countries in Africa which had, I think they're vaccinated at the most 0.5% of the population so far. So all these countries, they're extremely vulnerable to new strains, and there will be new strains, there will be mutations. We know that. So,
and this is because of, sorry to jump in, this is largely because of, as you wrote about this and several others as well, that because Serum Institute of India was supposed to be a very big supplier to that COVAX global program, which is distributing vaccines to poorer countries, and then they couldn't anymore because we needed that entire stock.
The government won't let them. Yeah. No, the government won't let them. I mean, they couldn't because they have basically reneged on a global contract. Well, the reason why they got that contract was that they would supply the vaccine to the rest of the world. Yeah. Now they don't want to do that anymore because the government won't let them. Because we have somehow convinced ourselves that these vaccines are Indian vaccines. I don't know what that means, but these are vaccines meant for other countries. These are vaccines under contractual obligations that we are supposed to supply to other countries. These belong to private companies, but we won't let them leave India. So all these countries are left in the lurch now
because of this crunch. But let me just ask you, Dr. Joshi, because now so many states are saying to the center, look, reverse your policy, go back to centrally procuring and distributing. Would that help? Dr. Joshi?
Absolutely, because it's like a catch-22. Even if you float a global tender, the global manufacturer like a Pfizer and Moderna says we can't supply to the states, we can only supply to the central government. And I think the central government has given us a reassurance, and I hope that they are able to maintain that assurance of 1 crore per day. If that is done, there is no problem at all. I only wish that that statement is converted into reality in the next 15 days to a month's time, and we can still meet the target this year itself. But we need, as I said, there are a lot of opacities there. But I am certain that they have done their homework right, and they'll be able to meet those targets. Okay. And central procurement is always better from equitable distribution. And I think the old policy which was started was a very, it was running very well. If you see the vaccination program,
yes,
from the months of 16th of January,
yes,
till the probably till 1st of April was running very well. After 1st of April, some hurdles started, and then the second wave started in a big way.
Yes,
and after
yes.
1st May, we have virtually derailed. I only hope that this is a transient phenomenon, and
that it comes back to, it goes back to
exponential way, and we are all secure and safe.
Dr. Rao, you also think that's the best way? I mean, go back to center, just procuring and distributing, right? Because trying to directly negotiate with vaccine makers in India or overseas, states and municipalities attempting that is just, I mean, it's not working. So
I agree, and I would like to add one more point here, Vasu, that currently there are 24 companies that have completed their phase 3 clinical trials, and majority of them are entered the market. And I think it's time for us to open gates to global tenders and open gates for bigger, multiple more companies, because I don't think 1 or 2 companies are going to be sufficing a population such as ours. And we need to bear in mind, even historically, whether it is smallpox or polio, we took more than a decade to vaccinate. So we will need a much larger strategy and much better micro planning.
If you need 1 crore doses a day, that's huge. I mean, you're going to need every possible weapon in the arsenal. But Professor Reddy, I mean, again, do you think that the center now will rethink this very, very confusing and fragmented policy? Because now even the Supreme Court has weighed in.
Well, and there are a series of steps that we are seeing in the media which suggest that they're at least trying to open up to greater import of vaccines apart from stepping up the production here. We have seen, for example, now they have said that they're going to permit Pfizer and Moderna, even with the waiver of the liability clause, which is a bit of a debatable issue, but nevertheless they've said that. Secondly, they've just announced that the requirement of a bridging trial for some of these vaccines cleared abroad will also be lifted. Earlier, they were insisting that after initiation of the vaccination, that would be treated as a bridging trial period. So I think we are now beginning to open up with many more relaxations rather than some of the conditions that we had imposed earlier.
So that's good.
We may get more vaccines,
Right, that's good. But Priyanka, the problem is that even if we are opening up, this dual or 3-layered pricing policy has meant that states and private sector are competing for this limited vaccine resource, and obviously private sector will have an advantage because they're paying a higher price. So you now have situations in states where the government vaccination program is derailed, but private vaccination is going on.
No, I completely agree. It's not just the dual vaccine policy, which I think has been widely criticized, but another issue is I think the opening up of vaccination for the 18 to 45 age group was not something that was recommended by NTAGI, keeping in mind the kind of supplies we had. In fact, an NTAGI member actually said that it was done due to populist reasons. I don't know how much this derailed the entire supply issue. I mean, if we had enough vaccines only for the priority groups, which is 45 plus and people with comorbidities, maybe we should not have, given into populist demands and, launched open vaccination for everybody. I mean, if you have constraints, you have constraints. There's nothing you can do.
Right. So Devashish, but the curious situation that we find ourselves in is that at one time we were literally positioning ourselves as the vaccine guru or the vaccine factory of the world. Now we are not able to supply to this world pool, but we are now scouring the globe to get countries to supply and companies to supply us vaccines.
our vaccine policy is now determined by the US. So we are looking to the US to find out how much vaccine they will send us. Because, like all the contracts that you're talking about, even if they are signed tomorrow, the vaccines won't materialize the day after. It will take time. So the vaccines that we can get right now are the vaccines that the rich countries can spare us. So we are now basically scouring the world with a begging bowl for vaccines. That's where we are. And we have dealt an irreparable damage to our reputation as the vaccine powerhouse of the world.
Yeah.
I don't know how many countries in future will sign contracts with Indian companies for vaccines. I have my doubts.
That's going to be a big challenge or a concern, Srinath Reddy, don't you think? That, Serum Institute, I mean, these are big, well-established vaccine producers, supply 50–60% of the vaccine stock to UNICEF, and now you have this whole question mark about, can you really deliver,
Well, most of the vaccines that we've been supplying to the world so far are related to women and child vaccination.
Yes.
We should at least keep up that commitment and ensure that our reputation does not suffer in that particular area. Whether we can actually quickly repair some of the damaged reputation on the COVID vaccination, that we must see. Of course, we do need to prioritize our own country, but some of the international commitments we have made must also be discharged.
Has to be kept. Dr. Joshi, when you try to reach out to these vaccine makers, as all states must be doing, what do they say? That we just don't have enough, or?
No, I think their commitment is to central government, because there has been some fund infusion by Government of India to both Serum Institute and Covaxin. Sputnik manufacturers are predominantly keen to supply the private corporates and private hospitals. So obviously beyond these three, there is a bottleneck. If there's a global tender, nobody wants to apply.
Right.
More or less, you see, it's like a zero-sum game. And I don't think there is a challenge. I think it's, I think we have to get the stakeholders in confidence.
Okay.
Government of India, Government of Maharashtra, or any government, state government, and the manufacturers, all three need to form a consortium.
Right.
And work together and mitigate this problem. I think Government of India is reasonably confident, and I wish that their confidence is translated into their promises. And I think if they can do it, nothing like it.
Okay. Well, the Supreme Court has now weighed in. So if not now, when? But let's see if, in fact, we do see a change in the way that vaccines are going to be bought and distributed. But we're completely out of time. Thank you all so much for joining me on Reality Check. Thank you so much for watching. Good night.